So we're going to talk about anti-clotting drugs. So before that, you need some knowledge about hemostasis. So you need to know the balance that the body always tries to balance between bleeding and clotting. So if you have too much bleeding, you will bleed to death. You will get hypovolemic shock. You'll die. And if there is too much clotting, everything gets thrombosed. So you'll get clots everywhere. You get deep venous thrombosis. You get pulmonary embolism. So you get stroke, because of too much clotting. So there needs to be a balance between bleeding and clotting. So we need to understand hemostasis. So this refers to how the finely regulated dynamic process of maintaining fluidity of the blood, also repairing vascular injury and limiting blood loss. And at the same time, trying to avoid vessel occlusion, that is thrombosis, and inadequate perfusion of vital organs. So either extreme, that is excessive bleeding, or thrombosis. So either of the extremes represents a breakdown of the hemostatic mechanism. So learning objectives, that will be clear after a few slides to come. So we have anti-clotting drugs. Actually, there is we might divide it into two. So drugs for coagulation. Okay, it's either there are two main groups, anti-clotting drugs. So this will be the bulk of today's talk. And we have drugs that facilitate clotting. So anti-clotting drugs, we have anticoagulants, heparins. In heparins, we have three categories. The high molecular weight heparin, low molecular weight heparin, and fondaparinux. And then we have the direct thrombin inhibitors, such as lepirudin, bivalirudin, and argatroban. So these are parenteral drugs. And we have an oral direct thrombin inhibitor, which is dabigatran. And then we have the factor Xa inhibitors, such as rivaroxaban, apixaban, and endoxaban. And then we have warfarin on its own. Okay, so warfarin is on its own. Heparins, you have three types. This one you have a few for this one, and warfarin is just on its own. And then we have the anti-clotting drugs, thrombolytics. So we have the TPA derivatives, such as alteplase. And then we have streptokinase on its own. And then we have the antiplatelet drugs, aspirin on its own. And then we have glycoprotein 2B or 3A inhibitors, such as abciximab, tirofiban, eptifibatide. And then we have the ADP inhibitors, clopidogrel and ticlopidin. And then the last drug category among the anti-clotting drugs is the PDE phosphodiesterase or adenosine uptake inhibitors. So it's a PDE inhibitor, and it also inhibits adenosine uptake, which we will show you a picture later on, a cartoon of it. So there are two types, mainly the dipyridamole and cilostazol. And then we have drugs that facilitate, enhances, helps clotting, the replacement factors, vitamin K, and the antiplasmin drugs. So mainly when we talk about anti-clotting drugs, which is the focus of today's discussion, so our focus is mainly on this part and not on this one. Okay, so we'll just focus on anti-clotting drugs, and these ones are quite straightforward. Maybe if we have time, we'll talk about it later on. So there are two groups. So the aim is either to reduce clotting. You either do reduce the clotting, or you dissolve the clots that have formed. Okay, you reduce clotting or you dissolve the clot. So generally speaking, when you talk about anti-clotting drugs, they are used in the treatment and prevention of acute coronary syndrome. Can be used in, some are used in atrial fibrillation, some are used to treat ischemic stroke, some are used to treat deep vein thrombosis. So the first two categories, the anticoagulants and thrombolytics, are both used for treating arterial and venous thrombosis. But the antiplatelets, these ones, antiplatelet drugs, they are just used for treating arterial diseases. So anticoagulants, they inhibit the formation of fibrin clot. So try to prevent this from forming. So this is fibrin, which is activated factor 1. So factor 1 is fibrinogen. So during the final stages of the coagulation cascade, you get it to be transformed from fibrinogen to fibrin. So this is fibrin. Okay, so this is a bit on how do cuts heal. Okay, this is a simplified diagram showing how blood forms a clot. Okay, so it's like they are jamming this area. They jam the area to prevent more bleeding, and then the skin and the blood release chemicals, tightening the edges of the cut. So they tighten here, form a scab, and they also release chemicals that attack the microorganisms like bacteria, and the chemicals also serve, or they function to stimulate the new growth of skin as well. And a layer of new skin forms, okay, allows the scab to fall off, or they just flake away, and the new skin will appear pink, okay, because blood is working to bring nutrients and oxygen to the area. So this is a bit on cuts, okay, so this is only partially relevant to our talk today. So this is just a brief recap on the types of cells. We have erythrocytes here, coming from the originally from the stem cell, okay, pluripotent hematopoietic stem cell. So finally we get a erythrocyte, and then we get platelets here from megakaryocytes. Okay, we have macrophages from monocytes. Okay, from this line we have the polymorphonucleated neutrophil, and we have the other cells. Okay, some are relevant and some are not relevant to the anticoagulation topic or anti-clotting. So basically, heparins and warfarin, heparin and the direct thrombin inhibitors are parenteral. Factor 10 inhibitors, we have parenteral and we have oral, whereas warfarin is just, we have oral formulations, but not parenteral. That's the common way of giving the drugs. Okay, so the coagulation cascade. a bit of revision on that. So it's started either by external factors such as a wound or internal factors, and the pathway that involves external damage to the body is called the extrinsic pathway, and the pathways that stem from trauma inside the body is called the intrinsic pathway. And both pathways start with the platelets sticking together, slowing blood flow. And then other proteins in the blood also become activated. And the proteins usually, they are found in the inactive form of called zymogen. And the zymogen gets cut or cleaved and becomes active once the coagulation starts. And all parts of the coagulation, whether the extrinsic pathway or the intrinsic pathway, they end up in a common sequence of events called the common pathway. So first, factor 10A is activated, and then factor 10A cleaves another protein called prothrombin to its active form, thrombin. And thrombin will cleave another protein, fibrinogen, so another protein which is called fibrinogen, into its active form, fibrin. So this one, fibrin. So fibrin is a long, stringy protein that forms a mesh-like covering in the blood vessel or over the wound. And this covering will trap more platelets, forming blood clots, which will function to stop any blood flow. So we can remember the fibrin and imagine the fibrin as like it's function like a glue. Okay, it glues the platelets together. So we have the APTT pathway or the PTT pathway, and then we have the PT pathway. The PT pathway is the extrinsic pathway. The PTT pathway is the intrinsic pathway. So the intrinsic pathway is the longer pathway. So we have factor 12, E, 11, 9, 8, 10, and then factor 10, factor 5 coming in. And then this factor 10, activated factor 10, converts prothrombin to thrombin, and then fibrinogen will convert it to fibrin. So in the common pathway, so the common pathway is from here downwards, okay? It's the place where the extrinsic and the intrinsic pathway, the extrinsic and intrinsic pathway merge. That's where it merges, okay, where it merge, and from here downwards, it's what we call the common pathway. So the common pathway, sometimes people try to remember it by remembering that they all involve the money that you have inside your pocket, the one that is less than $20. For the Malaysian context, you say less than 20 ringgit, $20. So we have $10 and $5. So 5 you can fix it into 10, okay, if you remember the Roman numerals. Okay, and then you have factor 2, which is prothrombin, and then factor 1, fibrinogen. So these are all involved in the common pathway. So another diagram from Nature video showing you the coagulation cascade from factor 12, 12A, 11, 11A, 9, 9A, 10 to 10A. Factor A is there, okay, and then factor 5 to 5A, prothrombin to thrombin, fibrinogen to fibrin, and we have the cross-linked fibrin clot. So then we'll start talking about the drug that is heparin, which is the first drug category under the anticoagulants. So we'll see you in the next slide.